Hi guys, this is Tabish. The purpose of today's presentation is to give you an overview of brief structure of CSS 721 to 726 unit. We are in 721 unit, but usually you're going to see similar approach of unit delivery across all these 6 units with the change in appropriate clinical contents. So these units are based on 4 activities, and traditionally we have the assessment and activities interwoven together, which I have changed for this semester. So you have a separate section where you are going to learn 4 different things related to this unit, and I'll encourage you to uh, participate actively in terms of reading and to cover topics regardless of focusing on assignment. So you do not just targeting what are the question and finishing the assignments, um, instead of just focusing broadly on how you can enhance your learning and how you can extend your reading into the area relevant to the unit. So this unit deals with gastrointestinal and also adverse drug reactions, drug interactions, um, blood and electrolyte, and it's really important that you focus yourself and try to learn about these areas independent to what's being asked. But in order for you to focus on how you're going to study and uh, what specific aspect of clinical care is important to practice, we have developed cases which are the example cases. I'm not going to talk about assignments under here, so I'm going to have a separate presentation related to assignments and how assignments are going to work in this unit a bit later under the assignment tab. But here I'm just going to explain you about 4 different areas that you need to focus on. All those 4 areas are linked to assignment 1 to 4 in the same chronological order. So structured evidence-based medicine is the first thing that you will be learning, then short clinical cases, then long clinical cases, and then also developing and preparing for some clinical presentation. Um, but then in assignment section, you'll be allocated specific cases that you are going to submit as an assignment. So how you're going to learn in this unit and how you're going to gather your knowledge so that you are well prepared for attempting assignments is by going through with the individual areas in this unit. So these modules, structured evidence-based module, short clinical case module, long clinical case, and clinical presentation will have relevant information. But let's discuss a little bit more about learning expectation in this unit. So you are expected to spend at least 8 to 10 hours per week per unit of your study, and that's not just focusing on assignment and finishing those assignments. It actually involved reading relative material, also searching specific clinical topics in the area relevant to your cases. So it will be really good for you guys to have an standard clinical text. I don't have a particular preference in terms of which way you want to go. So you can go from um, basically just Google your references, go to PubMed, go to university library and download papers if you want to study more about the subject. What I have found myself is that since did my clinical pharmacy master's long time ago, I can't even believe it's almost 30 years ago I did my master's in clinical pharmacy. I'm a big fan of both Koda Kimball and DiPiero's clinical pharmacy text. Though I found the pharmacotherapy pathophysiological approach by Joseph DiPiero, the latest edition, which is the ninth edition, a much more focused, and it have much it's always been more didactic in its approach instead of just having clinical cases included within the chapters as the Koda Kimball and Young's approach is with applied therapeutics. But what they have done this time is that they have, and for a long time they have this separate case book for their book, so you can read the case book separately to the actual book. But what they have done this time is that they have a separate section of clinical controversy. And that's a very good section because it's highlighted the fact that sometime as a healthcare professional, we are not totally aware of or certain about the standard of care. And there are so many exceptions to the rule, which they have included with having a box of clinical controversy. And I think that's something that really make them quite unique from this year on, where they have this new approach with the new edition. So I would recommend it, but it's and personally I don't get free copies from them. I never approach them for that. So I just have my own copy that I read and I find it quite useful. So I do not have any conflict of interest in suggesting it to you guys. And if some of you totally disregard this recommendation, that's also quite fine. So it's your choice if you want to go with a book or you want to go with like open resources, because there's so many resources available. You can read those things, and all I need from you is that when you go into specific areas, make sure that you know about that. And I'll give you an example of that in terms of learning expectation. So let's see if I'm again going to discuss later about plagiarism and implied declaration that you're not plagiarizing the work a bit later as a separate presentation. But let me give you a short idea of how you can prepare or how you can study for this unit. So you say if you go to a typical structured evidence-based medicine tab, you open an example case. So although the actual assignment will be to develop a PICO table and answerable question, search literature, identify some limitations or strength of the studies that you are selecting for your own answer, and then provide a reference answer. But basically you can use this case to learn even more. So if you read this case is about DPP4, which is the new oral uh, hypoglycemic agents or new oral agents that are used to treat type 2 diabetes. Some studies are showing that they are being used in type 1 diabetes as well. But basically this tells you that you need to actually read recent development in type 2 diabetes management. So if you want to be knowledgeable about this particular aspect, is going to help you across the board in other cases as well as in your long case. But in summary, you should be able to know not about just sitagliptin, but linagliptin, vildagliptin, exenatide, new regimen for insulin, what is the evidence about metformin and the maximum doses of metformin, basically overall the management of type 2 diabetes. So the way to do this is either you search through literature and identify a couple of useful papers about it, or just open a chapter in pharmacotherapy or Koda Kimball applied therapeutics, and these are the recent texts. So they spend quite a lot time in basically gathering all that evidence and writing a good chapter by experienced clinical pharmacists. So I thought it's much economical way in terms of my time to just buy a book which is like a couple of, I think it shouldn't be more than 200 or $150 at the time I bought it. It's like I got some specials of about 160, 170 from Amazon, but like you can search around and see where you can get a good deal about these books. But again, if you spend some more time in PubMed and literature review, you can actually identify very good review papers from where these guys are getting their knowledge, and you can make yourself even more knowledgeable. And the good thing about that is that you can use the same information in your cases while you are attempting these cases. So it's there's no right or wrong answer in terms of how you are going to study, but what I am implying is that these cases, these practice cases, are not just to look at the specific aspect, rather it identify learning needs. For example, if you look at this one, although it's talking about esomeprazole and clopidogrel drug interaction, but basically is asking you that, okay, as a pharmacist, what do you need to know? How do you manage patient with a STEMI? How do you manage patient with anasTEMI, which will be in more details in your 722 or cardiology unit. But from your point of view, you can look at, okay, what are the other useful drug interaction that I should be focusing on? What are the clinical significant drug interaction related to cardiology, related to gastroenterology that I should be focused on and I should increase my knowledge on? Same goes with the other case. There's a typo, so I'll probably need to change case 2 and then type case 3 here. That I'll do. I make a note here with me. So case 2 and 3. Um, that you basically need to study more about chronic liver diseases by looking at these cases. So do not, and that's why what I've done this time is I've separated assignments, which are these are the assignment description of all the assignments. What is assignment 1, 2, 3, and 4 versus what is the content material for assignment 1, 2, and 3, 4. So these are not just focused on assignments. These are focused on example cases that you want to increase your knowledge on. So again, these short clinical cases, although they have specific questions attached to it, because there's part of the assignment, and we can randomly assign cases to you at the time of assignment release date. But the whole idea is that when you read these cases, you can ask yourself that what else you need to know about the information being presented in these cases. So that's really important, that you take these cases as learning opportunities rather than just looking into isolation and focusing too much on your assignment. So I hope you get a clear message of what is the learning expectation from this unit, is that you read enough about not only about the cases, but also the contents of the case and what are the disease areas are being covered in these cases. So that you are much more knowledgeable when you are attempting these units. And once you finish CS721, you are quite comfortable with how you manage gastrointestinal. So if you look at gastrointestinal diseases, there are reflux, there's peptic ulcer disease, there's viral hepatitis, there are things related to peritonitis, well, it's more like infectious disease aspect, but pancreatitis, it is quite relevant to gastrointestinal. Crohn's disease, inflammatory bowel disease is also a big section of gastrointestinal disease. And that's why we have long cases which are related to alcoholic liver disease, Crohn's disease, anemia. And then we also have clinical presentation, which talks about basically new issues within the overall picture of gastrointestinal diseases. And then again, instead of just focusing on one or two because you don't know which one is going to come for your actual assignment, I'm going to go in more details. So you are expected to actually go through with all of these topics and increase your knowledge about it. There is no particular order in which you want to attempt this, although your assignments will be released sequentially. So your assignments will be released from assignment 1 will be related to structural evidence-based medicine, 2 related to short clinical case, 3rd related to long clinical case, and 4th related to clinical presentation. But basically it's just there for you to click on these topic and at least go through into details of these topic. And for that you need to make sure that you enhance your reading. You set aside a specific time each week, at least a block of couple of hours to study, say over weekend or over during weeknights. So make sure that you are allocating a specific time, as I've suggested, about 8 to 10 hours for each unit. And that's the only way that you can really enjoy the unit as well as get the most out of it.